video. Hello and welcome to the research operating room of Allegheny General Hospital in beautiful Pittsburgh, Pennsylvania. This short tutorial video is intended to familiarize you with the technique required for shipping Swan-Ganz catheter tips for the harvest of pulmonary artery endothelial cells at our core facility here in Pittsburgh. This is Gretchen Lentz, the project manager who has developed this technique. And for those of you who do right heart catheterization routinely, I think you'll have no trouble adopting this method, as it's really quite simple. In fact, there are really only two key technical considerations as you carry out this protocol. The first is that the tip of the Swan-Ganz catheter spend as little time as possible in the room air after it's been removed from the patient. So clipping and shipping quickly. And the second is to make sure that we rinse as much blood as possible from the tip of the catheter without rinsing away the endothelial cells. So Gretchen is going to show you how this works, and she will simulate. This is a Swan-Ganz catheter we obtained from a patient, but we're not taking cells from it. And she will dip it in some blood to simulate what you're probably used to when the catheter comes out of the patient's body. So Gretchen, if you could show us how this works. So she's got the catheter tip here, which has, as you can see, some blood on it. This is probably something that you're familiar with. Now what you want to do is dip it into the rinse solution, which is just sterile saline, and just sort of rinse the blood away. Now, the way that we like to think about this is that the endothelial cells on the tip of the catheter are a little bit like lipstick on a coffee mug. You have to really rub them to get them off, so they should stay on there and just gently rinse and swirl it around. So she's now cut the catheter tip, and she will transfer it to the shipping container, which is another 50 ml Falcon tube, and make sure that the media in there is ice cold. In fact, all of this should be done with ice cold materials. You see here our bucket. So she's taking the tip, transferring it over, and the length of it really doesn't matter that much. This is probably a little bit long. Oh, she's saying it's not a little bit long. This is normal. So now you see the catheter tip is immersed in the media. The media is ice cold. You'll simply pack this tube up